Hello, my name is Nya Fowler. Today I will present my research title From Intention to Outcome Interventions Between Pregnancy Intention and Mental Health. This project was completed under the mentorship of Dr. Lilanta Joy Bradley at the University of Alabama. My work examines how pregnancy intention relates to mental health outcomes among minority women and explores what intervention characteristics are associated with improved outcomes during pregnancy and after childbirth. Please feel free to contact Dr. Bradley or I via email. We are open to questions, feedback, and even invitations to collaborate on future projects. Minority women experience a disproportionate burden of prenatal mental health conditions, which can include depression and anxiety. Pregnancy intention, commonly categorized as intended, mistimed, or unwanted, and has been constantly linked to these specific outcomes. Despite this evidence, pregnancy intention is not routinely assessed or addressed within mental health or prenatal care. This gap is particularly concerning given existing inequities in access to culturally responsive mental health services for minority women. This study addressed the question among minority women, what characteristics define successful interventions addressing pregnancy intention and mental health outcomes during prenatal and postpartum care? During this specific study, a literature review was conducted using peer reviewed articles identified through PubMed, Google Scholar, JAMA, and the University of Alabama Library. The key search terms included pregnancy intention, minority women, mental health outcomes, and prenatal and postpartum care. In total, 20 studies met the inclusion criteria and were synthesized. Across studies, unintended and mistimed pregnancies were constantly associated with poor mental health outcomes during pregnancy and postpartum. A clear gradient effect was observed with unwanted pregnancies showing the highest risk, followed by mistimed pregnancies, while intended pregnancies were associated with more favorable outcomes. Depression was the most frequently assessed mental health outcome. Importantly, minority women were less likely to receive counseling or attend postpartum follow up visits, highlighting ongoing inequities in care delivery. While associations between pregnancy intention and mental health are well established, relatively few studies evaluate integrated interventions. Existing interventions characteristics include preconception counseling, preventative prenatal mental health programs, group prenatal care models, patient navigation services, and proactive outreach such as appointment reminders. Culturally responsive communication and partner inclusive support were also identified as important components. However, most studies examine these elements indirectly rather than testing integrated intervention models. Several gaps remain in the literature. Few studies explicitly test interventions that integrate pregnancy intention with prenatal mental health care, and pregnancy intention is often measured using single item assessments. Additionally, minority women remain underrepresented in intervention trials. These findings underscore the need for standardized pregnancy intention screenings, culturally responsive and stigma reducing mental health care, and flexible delivery models such as telehealth and proactive outreach, particularly for women experiencing unintended pregnancies. In closing, pregnancy intention is a meaningful determinant of prenatal mental health outcomes, particularly among minority women who face compounded structural and clinical barriers. Although the literature clearly demonstrates association, intervention research remains limited. Future studies should move beyond observational design to test integrated, cultural responsive interventions that address both pregnancy intention and prenatal mental health, with the goal of improving equitable outcomes across the prenatal continuum.